2015, I moved to, yes, thank you. So 2015, I moved to US and now I'm in Seattle, and I have a clinic wherein I do Ayurvedic consultations and different therapies there. So it's a pleasure that I'm here today. It's my first time coming to UW. I've come here before, but not in a classroom, of course. So thanks to Karthik for giving me an opportunity to share my experience with Ayurveda. So Ayurveda is it's a science of life. It's a and medicine and healing, which is originated in India almost 5,000 years back, and still it's practiced widely in India and also in US and other Western countries. Though it's a very old science, still it is practiced because it's very basic, and it talks about nature. It talks about what kind of diet, lifestyle, and different Ayurvedic medicines and therapies can help in a holistic healing of a person or a complete health of a person. So my experience I'll share with Ayurveda. I was really young. I was 10 years old when I was once diagnosed with jaundice or hepatitis. And my parents took me to the doctor, and we did treatment for almost 1.5 months, but there was no cure. It was just not, all the symptoms like fever, weakness. I was not able to go to school for at least 2 weeks. And finally, somebody suggested them to go to an Ayurvedic practitioner. So my parents took me to the practitioner, and I remember that they gave me some specific, very basic powder medicines, which are like herbal powders, and some Ayurvedic, liquids, decoctions that we have to make at home, and I used to have it at home, and some dietary changes. And within 2 weeks, my jaundice was completely cured. So that was my first experience with Ayurveda, like such an acute condition. It could, they could take care of it and cure it just by simple home measures. So after 12th, I opted for becoming an Ayurvedic practitioner. So I joined the college, and I was working as a medical officer, government medical officer in India before moving to US. So how many of you know about Ayurveda? Great. Great. Karthik also knows. So I will give you a brief introduction of this science. It's a system of holistic health practices, and it's originated in India thousands of years ago. And it was basically the Indian scientists or the sages. They had done a lot of researches. They've observed the nature and human beings and how the nature impacts the human beings. And that's how they had, created the science of Ayurveda. And they pass it on to others via different texts. They used to write all these in classical text. So it's a Sanskrit word. Ayurveda is a Sanskrit, it's a term. Ayu means life and Veda is science. And it's the science of life or longevity. And it encompasses diet, lifestyle changes, yoga, and meditation. And we all know about yoga, right? So yoga is a sister science of Ayurveda. Ayurveda and yoga go parallel. So most of us know about yoga, isn't it? We all have practiced yoga in one or the other yoga classes, right? Most of the yoga instructors also introduce Ayurveda to their students because they know that how diet is also important in our overall health, right? So just doing physical exercise is not enough. We need to also go deep inside and also work on our systems and also mind level. And that's what Ayurveda says. So Ayurveda and yoga are like sister sciences. Earliest references of Ayurveda are found in Vedas, which are the actual texts, which are written treatises, which are available in India. Still, they are preserved. They were written on palm leaves. And in today's world, in US also, Ayurveda is now practiced. There are a lot of Ayurvedic institutes where Ayurveda practitioners and Counselors and therapists are trained. We have National Ayurvedic Medical.
Sorry, can you turn on the video?
Turn on. Okay. Sorry. Hello, everyone. So, in US in 1970s, when Maharshi moved from India to bring spirituality to Western countries, he brought Ayurveda in 1970s. Um, Most of us know about transcendental meditation workshops. So that's when, Ayurveda also came to US. In 1970s, Dr. Vasant Lad, Dr. Deepak Chopra, they all introduced Ayurveda to people with their books. Dr. Deepak Chopra has a very famous book on Ayurveda, and and now we have, and they also helped in establishing National Ayurvedic Medical Association, which there are more than 800 practitioners and therapists are there who are members of NAMA now, and they are practicing in US. In India, there are at least 7 lakh Ayurvedic doctors and practitioners practicing. It's not just an alternative medicine, but also a mainstream medicine now. So there's the second question arises, how does just eating right and just some Ayurvedic herbs and medicines can help? So Ayurveda truly, they're like some basic principles of Ayurveda. It says, that we should truly honor the nature and we should flow with the nature. Every changing weather, we need to change our diet, our lifestyle in order to be fit and adjust well to the next coming season or coming weather. So that's what it says. So, understanding the laws of nature and following it. And it also honors the uniqueness of each individual. Like, like if you see in your family also, your brother, your sister will have, they have different body types, they have different likes, dislikes, their, sensitivity towards any food or, anything. It's quite different, very unique. So that's what Ayurveda says, and we'll go deep into it. We'll understand what is that uniqueness about yourself. So I'll be passing on this questionnaire that you can fill out. And, there are some questions and there are 3 options to these questions, and it will help us determine what is our dosha, Ayurvedic body type, what is our Ayurvedic constitution. So yeah, so Ayurveda says we should understand and follow the nature, and also identifying various states of health and imbalances. So, bringing awareness from outside world to inside world. Understanding when you wake up in the morning, sometimes we wake up with a lot of energy, focus, and enthusiasm, but it's not every day. Sometimes we wake up with very less energy. Sometimes we feel that, okay, digestion is not good enough. I'm feeling low, though I'm eating well and sleeping well. So those are the states of mind that also impact our body. So Ayurveda says we have to become aware of our own body and our own mind so that we can adjust our daily practices based on that, to have a healthier and more energetic day, so yeah. Then it talks that everything in the world is made of 5 elements, 5 basic elements, that is earth, water, fire, air, and space. And if you notice, we all have these 2, right? Our body, our bones are all minerals, that is earth element, water element, that is all the plasma, blood, everything is, that is water. We have 60% of our body is like water element. Then fire element, all metabolic changes happening in the body, digestion, metabolism in the cellular level also, that's all governed by fire element. Then air element, that is, sometimes we feel spaced out, and like, because there's so much of thoughts going on, isn't it? And we say, oh, my body is feeling very dry today, or my hair is feeling very dry today. Allergic problems, right? Eczemas, those things. So they are all like, all the movements, if you see, are governed by air element. Movement of nerve, like of the sensation of the in the nervous system, movement of food from the mouth to gut, and elimination process, all that movement is basically air element. And the last is ether or space. We all are in the space, and space is inside us, isn't it? Our cells have space in that. So space element. So all these 5 elements make 3 bioenergies. We call it doshas. So we'll go and learn about these 3 bioenergies So first energy is, the next slide is this, all about, body types. So fire and water combine and they make one bioenergy called as pitta. There is no actual translation of these terms because they are Sanskrit terms, but we can correlate it to metabolic energy. And the second one is vata energy, which is actually air and ether or space. The third is kapha energy, that is earth and water element. These combine in the body and they make different, so each individual, if I have more of air energy or if I have more of vata energy, I'll be having these body qualities like light, rough, mobile. My skin will be dry, rough, mainly, flaking, cold, thin. Those are the qualities which are mentioned here. Then if I have pitta energy, which is high, if I have high of pitta energy, then these are the qualities that I might have: medium body frame, regular sleep, and focused, very organized. If you imagine a person which has high fire in them, how they will be very organized and systematic, have leadership qualities, very good in talking. Yeah. So they are high pitta energy. The third element or the third body type is kapha, that is earth and water. Now imagine a panda happily sitting. Yeah. So it's like a very generous, they're very well built, very unctuous skin, black hair, thick hair, and very large body type. It's easy for them to put on weight, but hard to lose weight too. So that's the kapha body type. They're blessed with very good memory. Yeah. And very good sleep too. So if you see, like, there are people who can actually sleep on the couch when the TV is on, like nothing happens to them, even if there is like a lot of chaos happening around them. Their sleep is so good. So that is the third body type. Then there are combinations. So there could be like a combination of vata pitta, pitta kapha, kapha vata. So there are total 7 body types according to Ayurveda. And why we need to understand it? Because if we know our body type, what is our elemental constitution, then we can live life according to that and stay healthy and be in our own nature. And that's the goal of Ayurveda. So Ayurveda says a healthy individual is a one who is happy in their own state of natural being. Yeah. So who wants to know about their body type? You want to know? Yeah. Okay, so I'm going to pass on this quiz. It's quiz time. So please fill out these questions and see what is your body type.
Does anyone need a pen or we can share? Anyone need a pen or pen?
Yeah. So for example, if I have fever, why am I having fever? I can just take a Tylenol and suppress that symptom. But what is the root cause of the disease? Ayurveda focuses on treating that. Yeah. If a person gets allergic sinusitis or rhinitis very frequently, we need to also understand the person's body type. Is he having a kapha body type? Then they are more likely to get pollen allergies or different kinds of sinusitis and rhinitis or congestion problems. So understanding prakriti or body type is important, and also then it gives you an idea of, like, how to treat that. So that these are the two goals of Ayurveda. Yeah, as I was mentioning, there is this chart which says the difference between Ayurvedic medicine and modern medicine. Ayurveda is a comprehensive cure which balances the body and treats the root cause of the disease, and modern medicine tries to focus on the management of the disease and the symptoms. The second is treats all the diseases as psychosomatic. It says that if there is definitely a seed of any disease is also originating from the mind level. If you are if there is something going on in the mind, or there is some kind of a stress going on in your mind, it will definitely have an impact on your body. Whereas in modern science, it is like, illness is independent of the mental state of a person. Then treatments are specific to each individual. It is very unique to the vata, pitta, and kapha body type. And here it's quite generic. Like if there is a cold, like anyone can just, take cetirizine or Benadryl. So, but in Ayurveda, it's not like that. You have to follow what is your body type, and based on that, so that you have very minimum side effects or almost no side effects. Again, here it uses organic natural products, healthy food, yoga, and other alternative ways to stay healthy. And in modern medicine, we use chemicals and drugs, which are often having a lot of side effects. Ayurveda is quite affordable and it's sustainable, whereas modern medicine is very expensive. Focuses on preventing the disease, and here modern medicine, it focuses on temporary cure or management of a disease. Of course, both are important, but this Ayurveda can be a very strong alternative medicine where we can focus on preventing the disease than cure.
Good question. Where would you say modern medicine helps where Ayurveda may not be able?
Yeah.
Is there a scenario?
Yeah, for example, if there is an acute case, if there is a stroke case, then definitely, we need like instant result or instant effect. So, modern medicine can definitely help there. And to prevent that, or further recurring or healing of the patient, then Ayurveda can help in that case. So I have two of my cases I would like to share, like present and show you how Ayurveda has helped cure two of my patients. First one is hyperacidity, which is a very, very common disorder right now these days. It's a chronic condition, which is where the food content or the acidic content goes upward, and it causes heartburn, acidity, and sometimes headaches also, and vomiting at times. My patient, who was 34 years old, and she was a cashier at a grocery store, and she had symptoms like acid reflux, heartburn, headaches, nausea, and loss of appetite, and she would always feel very weak and exhausted. And this was going on for almost 1 year. And she used to take omeprazole at least once in every other day to subside this problem, but it was not a cure. Like it was just recurring again and again. So she came to me for she was looking for a permanent cure with Ayurveda. She had no other major problems or health issues. Her body type or Ayurvedic profile was Pitta, and Pitta people have more of fire and water element, and they're more prone to acidity and those kind of issues, metabolic issues. So in this condition, when we checked her, so in Ayurveda, there's one way to know about your body type, and is through the quiz, of course, but there's one more way, is to check the pulse. by checking the pulse, we can understand what is your body type, the real body type, but also what is the imbalance or current imbalance going on. So she had a vata in pitta imbalance going on in the body. And based on that, we planned her diet. We did some marma therapies. Marma therapy is Ayurvedic acupuncture, acupressure. And it's a and then we also planned some Ayurvedic herbal supplements for 3 weeks. So after 3 weeks, she within first week itself, in fact, within the first 2 or 3 days, she could see a big difference in her heartburn and acidity problem. And she completely recovered within 3 weeks. And like still, she is following just the Ayurvedic food and the lifestyle, but she is like not dependent on any medication anymore. So another case was insomnia. Again, insomnia, yeah, or sleep disorders are very, very common nowadays. At least 14% of US population has some or the other sleep issues or sleep disorders. And one of the most common is insomnia. So, and it's more common in female patients than in males. And one patient who was 44 years male, he came, he had a insomnia. It was very hard for him to fall asleep. And if he would sleep, he would just wake up within 2 hours. So he had a very hard time with that. He was suffering from almost 4 months. And then he came, like, he was just taking some medicines like melatonin and those things to, temporarily give him some relaxation, but it was not working. It was not permanent. His body type was pitta body type. Again, very sensitive, very, like he used to kind of overthink about so many things. So that may be one reason why, this started. He had no other major health issues apart from that. So we planned a vata balancing diet. And, as I was telling you, vata is basically the element of air, right? Air and space element. So it brings a lot of restlessness in the body and mind. So in this condition, we gave him herbs and, therapies which were vata balancing. So we did Shirodhara, wherein we pour warm medicated oil on the head for at least 40-45 minutes, followed by gentle head massage. And then marma therapy, which is Ayurvedic acupressure, was given to him. And some organic food supplements, ashwagandha, which is a very, very famous and common one. How many of you know about ashwagandha? Yeah. It's available even in Costco now. So yeah, ashwagandha. And we did bakopa, which is brahmi. And he took this for 4 weeks. And by end of 4 weeks, he could sleep for 6 hours at least 5 days in a week. And before that, it was he was just sleeping 2 hours maximum. So this helped him a lot, and he felt more energetic, focused in his work. And all the other symptoms like letharginess, dullness, all that subsided. His appetite improved, his metabolism improved. So of course, because sleep is a very important pillar of health, right? So we all need to sleep because that is the time our body is rejuvenating. So yeah, so this is another case study.
Quick question.
Yeah.
So you said these measures were balancing the vata, right? Could you speak to what may aggravate or take someone out of imbalance?
Yeah, so that's a very good question. So what could take you into imbalanced state of vata? So if I have a natural or normal vata in my body, the natural function of vata is to give you energy, to give you lightness, to make you active during the daytime. But if I'm like overstimulating my senses by maybe watching movies which are too too violent, or like using phones too much, or interacting with people too much, if I'm not eating like enough nourishing food, I'm just eating maybe just like very dry food, like chips, crackers, those kind of things. And yeah, if I'm traveling too much, or if I'm working out way too much than what I should be doing, like how much I should be doing, those factors increase your vata element in the body. And that may lead to like, sleeplessness, dryness, eczema, all other vata related, air related imbalances. If I'm a pitta body type, if I have a more of fire element in my body, if I'm indulging too much into eating spicy food, very hot food, sour food, or I'm like, I'm getting into too many arguments, like, mentally also I'm involving myself in very fierce things. So that will aggravate pitta element in me, and that might lead to complications like hypertension or digestive metabolic disorders and those things. So yeah, like, those are the things. If I have a kapha body type, the third body type, um I'm already very well nourished, but if I'm having very sedentary lifestyle, if not, I'm not doing anything, I'm not doing yoga, I'm not walking, I'm just being on my couch watching TV and just eating, that is gonna like give that nourishment part, like it's gonna go way beyond, and it's gonna increase my kapha. So we need to understand our body type so that we can balance it out. If I'm pitta, I should not eat too much of spicy food. I should not indulge into too many arguments, and stay away from unwanted, too many, violent thoughts and those things. So just to find that balance and follow it. Okay.
Are we going to a different topic?
Yes.
So if anyone else has any Ayurveda, you can find the body type based on pathway, right? So I think this is very more kind of a
It's, yeah.
of your hand and how
Basically, we don't really do the heart rate. We don't really assess the heart rate here. Not just the heart rate, but there are so many other things that we see: the pulse, the pressure of the pulse, the fastness of the pulse, like how intense it is. So those are all the things that we also check, not just the heart rate, to see the body type and the imbalance going on. So yeah.
So is it measured using a device, or is it just
Not right now, but the research is going on to invent a device which can do that pulse reading. Right now, all the Ayurvedic practitioners, they are well versed in in checking the nadi. We call it nadi. It's not just the heart rate or pulse; it's called nadi. And right now, we don't have anything to do, like no machines. It's just human beings who are doing it. Yeah.
So just to translate what you just said, it looks like pulse assessment to detect imbalances in the body. It's like having a time series of the pulse rate and looking at patterns that are, falling in certain categories, and then using that to see if you're of this body type or if you're having this kind of imbalance. So it's basically pattern recognition in the pulse that's being done by
Right.
Ayurvedic practice.
Yeah. So here we are talking about marma, right? I did discuss about it in my previous case, and in this case also we did marma for this patient. So we thought like we'll just introduce marma. It's like a Ayurvedic acupressure points. Uh, we all are like familiar with acupressure, right? So they are the vital points of the body where different types of tissues and different types of cells meet. Basically, there are the junctions or anatomical locations in the body where muscles, bones, and ligaments, they all come together. So there are a total of 107 marma points. And in this therapy, we just give a very gentle pressure on these marma points to stimulate them. Any blockages in these marma points are gently, if you have come across trigger point therapy, like usually if you go to a therapist, they do trigger point therapy. So basically we are just being there in that point and helping that point to release the stress from that particular zone or area. So here we do this therapy to relieve chronic pain, improvement in immunity, and it has a very good effect on digestive system, hormonal balancing, and also respiratory system. It helps in releasing some hormones which help in better sleep and cognitive function, and also improve the focus of the person. So marma is a very, very famous, very common therapy, Ayurvedic therapy. And according to a research done in Banaras Hindu University in India, marma has shown a very good result, like immediate result in balancing and managing the hypertension. Like it helps in calming down the nervous system and balances the blood pressure. And here's one chart that we took while we were doing marma to a patient. She is 32-year-old female. We did this reading using Apple Watch. And if you can see, this is just a 10-minute marma therapy. And within few minutes, her heart rate, which was at least 80, dropped to 63, which is a big, very significant change. So marma is, this is where we can actually use these new technology and gadgets, and also take help of data sciences to collect data from people and do more researches actually. So that's the only thing that I think Ayurveda is lacking. A lot of research and database we need to, generate so that we can.
Could we go back to the previous slide?
Yeah. Sorry.
Yeah. So there is a 70% drop, right? Is what it's showing. So this kind of a drop in heart rate, do we expect to see something like this if someone listened to music or someone was doing some other relaxing activity? Would you see some, like in your experience, would you see this kind of a drop?
Not 17%. There could be some change, but this is, very unique.
So we would say in our terms, we would say it is statistically significant change to suggest that the treatment had a direct impact on the heart rate.
Right. Yeah.
Is the 17% taken from like initial resting heart rate?
Yes, yes. So the patient, when she came in, we made her like sit comfortably for a few minutes. Then we did check her rate. Then we started the treatment, and she was in the same position. She was sitting throughout the session, and we did the reading throughout the whole session. She was sitting, and after that also she was sitting. And this is like end of the treatment. It has increased here, if you can see in the end. So yeah, it's like from the resting heart rate.
So the end of the graph, the patient is not doing any strenuous activity.
Yeah.
Is this data consistent across different individuals or
It varies individual to individual. Yeah, the more higher the heart rate is in the resting state when we start the treatment, we have seen a big difference in those patients. For example, someone who has say 68 as a resting heart rate, there is like maybe say 10% change. Yeah.
So it's only 1 minute.
Yeah, yeah, yeah.
So I think a lot of people will say it's like meditation.
Oh yeah, yeah. So this also basically this effect lasts for a long time. Not like not that 63, not 17% difference, but if they do it, like it depends how many times we have to call the patient. It's just one session and just 10 minutes that we did. So usually the session lasts for 45 minutes. And we do each step very very slowly. Like we stay in each position for at least 1 minute to 1 minute 30 seconds in each marma points, each acupressure points, and that has actually a long lasting effect. And we do it for those who need it, like hypertensive patients in them. We do it at least 5 to 6 sessions in like 10 to 15 days time. So yeah, every other day we call them depending on their their need. It's not permanent change. Again, as I said, like if they go back to their things that aggravate their thought process or pitta, then it might go high. So here we are trying to kind of educate them that this is the difference when you are resting. So if they are meditating regularly, this effect will it will last longer. Like if they're meditating well, if they're sleeping well, if they're eating well, then the effect will last longer than, if they're going back to that tension state of mind.
So, follow-up question on that is, as far as I understand, we go to sleep when our heart rate slows down and when we tend to relax. And because the heart rate is going down with this treatment, would you say this helps sleep?
This helps sleep. Yeah, this helps. This has helped a lot of people to get sleep, better quality sleep. Yeah.
So if someone is having, if I'm not able to sleep right now, it's already been 2 hours, and I have someone available to give me this treatment, would you say I would fall asleep in some time?
Yeah.
Based on this graph.
Yes, that is possible. Most of the patients who come for marma, they they go in that deep state of either meditation or rest, and sleep.
I may have missed something here, but acupressure is it just external or
no? So acupuncture is where we use the needles. Acupressure, we use very gentle pressure.
So you see that in a specific condition, right? Is it some specific position like that?
Yeah, usually when we do the first few minutes where we do the cranial hold, we start from the cranium, we hold the cranium, we do a polarity routine wherein we hold the head for at least 3 to 4 minutes. And that's the time there is a maximum dip towards the end of that cranial hold. And then we move and do different other body part, like different points, other points of marma. So yeah, this is the point where there is maximum dip in the heart rate.
Is there something that I could do on my own, like say if I'm at work or something, feeling anxious?
Yeah, of course. Okay. We can do that. Like we can do some points here if you are interested. Yeah.
How many of you would be interested?
Okay. So here's a simple, very simple one where the research that I was sharing about the blood pressure change doing one marma point. So in that, the point where your middle finger touches the palm when you fold the fingers making a fist, there's a point here where it touches. Yeah. So it's like a triangle. It's like when you press it with your thumb, you'll feel it's kind of tender. It's when you go a little bit deep, you just move it like circular movements and find that tender point here. Yeah. Do you see? When you hold it for some time, you will see that your heart rate, actually your blood pressure is actually, it helps in calming down your nervous system. It goes down. So this is something that you can do yourself. There are a few more things that that I can quickly show you or demonstrate that you can try. So yeah. So what we'll do is we'll just hold this point here. Could you find it? Is it the tender point here right in the center? When we hold it, we'll just do 5 to 8 deep breath in and breathe out. If possible, we'll keep our eyes closed and back straight. You need to press till the point you feel that pain. And just be there with that pain. You may slowly and gradually open your eyes. And relieve your hand. Any difference do you see? At least mind is calm now. Yeah. Yeah. So there's one more. Oh yeah, you were reading it.
Yeah.
Did you see any change?
Mine actually went up.
Oh, okay. 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 So let's try something else. So there's a point here right at the beginning of your eyebrows. So when you press your eyebrows like this, there is like a dip here, just underneath the first, like where the eyebrows start, right under that bone where there is this elevation. We'll try to hold it, like kind of pinch it with your index finger and thumb and just be there. And breathe in and breathe out. Relax, relax your shoulders. And relax. Second point is you can just pull your ear, pinch your earlobes, the down ones, and just hold it. Don't press it very hard, just hold it. And the top of the ear. Give it a nice pull and let it go. Okay. Okay. Another point is right here in the trapeze muscle, where you have like the midpoint of your upper trapezius, right here in the center. Just imagine a line from your neck to your shoulder and the point which is right here in the middle. It's a little bit tender for all of us. Yeah. Because we have a lot of stress in our shoulders. Breathe in and breathe out. And let go. Okay.
It does feel like if someone else could do these points, it's so much easier.
We can do for like maybe one of the
So you
students.
can demo.
We can, if it's okay. Okay. All right. So how are you feeling now? Little bit calm, relaxed. Yeah. So, but for this effect, you need to actually take the therapy like from a person who is expert in that, or those who have been practicing giving marma sessions. So this is because however best you try, we don't find or locate those points so well. And the pressure, and you're not completely relaxed when you're focusing on being on the right position and those things. So let the therapist do that, and just try it sometime whenever you come across some marma practitioners. So yeah, I think that's it. Do you want to add something with how data science can help Ayurveda?
I think the marma is a very good starting point. Wherever we can collect data and show that there is improvement, I think that's a great graph to expand on. Anyone else?
I wonder if the categorization into the different types. Like, data science can show that people really do naturally cluster those kinds of things and real correlation.
Yeah. Yeah, that's a good point. Like diseases which are very frequently occurring, say stroke or hypertension, in which body type it's more common. So we can do some research with the help of data science.
So these ancient, this Ayurveda is an ancient body of work, right? And people have observed maybe in their own ways that these body types correspond to these kind of characteristics. So that bringing that out more empirically is probably what you're suggesting.
I have a general doubt. But from some doctors, there's this small term going on between Ayurveda and there was a discussion. And what came up was Ayurveda uses a lot of steroids. That's why some doctors probably, I don't know.
Okay.
Is there any proof in that? Like all these leaves and Ayurveda medicines are made using all the leaves and stuff, right?
Yeah.
So is there more steroids in Ayurveda that
well, I completely don't believe this because, it's mainly diet, lifestyle, and Ayurvedic medicines which are grown, and they're organically grown and cultivated. And nowadays, there are so many standards like HEPA and, USDA, FDA certifications. So definitely there's no scope. Like, maybe there were some old times when this might be happening, but nowadays the rules and restrictions are so high that it's definitely not possible. Yeah. And of course there is, why are we pointing out Ayurveda using steroids when modern science is actually using steroids? Like, what difference does it make? Yeah.
So just to clarify, the Ayurvedic medicines are completely
they're completely plant-based.
plant-based.
Yeah, there's absolutely no metals used in that. And now, because government has been implementing rules and doing a lot of standardization of Ayurvedic medicines, all the Ayurvedic pharmacies have to get certified if they want to sell their products. So yeah, they're all certified, organic, HEPA and everything, they have to get to at least to sell the medicines. But you never know, there could be something going on in smaller places. They could be.
Basically, it's good because it's standardized right now.
Yes.
So if there was any bad practices, it's all filtered out.
Yeah, it's all filtered out. Yeah, it's now in US also there are so many companies like Sri Ayurveda, Banyan Botanicals, Maharshi, which are available on Prime. So like so many people are buying it. Even the modern medicine practitioners, they are recommending it. So.
One thing I think we can probably do is like the case studies that you mentioned, like where someone was having hyperacidity for I don't know how long.
1 year, yeah.
Right, and they were taking over-the-counter drugs, and it was not helping them. But then in 15 days, right, 2 weeks.
2 weeks.
So maybe there could be statistical studies that can say that, because it's a combination of things, right? You mentioned therapy and medicine and change in diet. So we don't know which ones might actually be impacting that particular hyperacidity, but as a combination, maybe that could be like treatment, and then control can be just do whatever you've already been doing, and then measure these significant statistical significance and the difference. So that kind of study could, I think more of those studies can help with the case studies that you mentioned. And I think, yeah, marma is like probably one other one.
Yes.
Yes.
Is there Ayurvedic diagnosis or that we discussed was more towards treatment? So is that like I have kidney disease, I don't know that I have kidney disease. So then I go to a Ayurvedic practitioner and says, he or she says, you have
Yeah.
kidney disease.
Yeah, so there are ways of diagnosis in Ayurveda also. We do follow all the standard diagnostic measures like heart rate, pulse, and everything. If needed, we send patients, we can refer patients for scanning different kinds of readings. So that's there. And of course, Nadi Pariksha, that is pulse assessment, is there. There are other ways where we can check what dosha is in imbalance. So yeah, like we are using both modern technology and ancient science for diagnosing different therapies, different diseases.
So is it a evolving field like that? Because it's like traditionally been practiced in a different way. Now it's more.
Yeah, we are adopting, we are moving with the technology. It's like technology is not just for modern medicine, it's for everyone. So yeah, I mean, we are like, because we need the data to show to people also, right? So for all the studies, we are using all different parameters of, all the health.
So it seems like Ayurveda can really help with any lifestyle disorders, right? Like insomnia seems like a lifestyle disorder.
Yeah.
Phone gadgets and hyperacidity as well, not eating right. So would you say if you were to follow Ayurvedic, the imbalances that you spoke about and take care of it, then it would, like, would that be connected to the preventative aspect?
Yeah, I think, yeah, because it's like, that's the first focus is preventive care, like to have a healthy lifestyle. And I think Ayurveda can help modern medicine because that's what we are lacking in the more current system of medicine, the preventive aspect, right? So we can, come up with, diet plans and lifestyle plans, yoga, introducing yoga and meditation in everyone's life so that they don't have to go to hospital, they don't have to see the doctors. Okay, thank you so much. Yeah.